Hello, everyone. My name is Jeremy. I'm a P4 student that's going to talk to you today about diabetes. One of the other students that's involved with this, Haley, she'll be during the live Q&A to talk about this at a later time, but I'm just the one that's going to go through this PowerPoint with you. So these are just kind of like my objectives I kind of wanted to focus on during this presentation. So we just want to be able to define what diabetes is. We want to understand the function of the GI tract. Some of you may have had some background when it came to the GI tract, and maybe some haven't, so we're just going to do a little refresher on it. We're going to examine the process on how the body breaks down our food into the sugar and getting us energy. We're going to kind of distinguish the difference between type 1 and type 2 diabetes. We're going to be able to describe the common signs and symptoms of diabetes, analyze the treatment options associated with diabetes, and then evaluate what the pharmacist kind of can do and what their role is when it comes to diabetes management. So what is diabetes? So in its simplest form, diabetes is just how we regulate our blood sugar. So how much sugar is floating around in the bloodstream. The breakdown of what the different terms mean: diabetes simply means excess urine, and malus just means excess sugar. And this kind of little photo is just kind of showing that, not everyone has, is going to be normal blood glucose all the time. It is going to fluctuate. We just want to make sure it's staying within a set range for people that don't have diabetes, and also those who do have diabetes. So this is just kind of the overview of the GI tract. So you kind of have, as food comes into the mouth, you have saliva glands that help break down food right at the start. Food travels down your esophagus into the stomach. The stomach is where we get a lot of chemical breakdown through enzymes, and we get mechanical breakdown through the movement of the gut. The liver is kind of responsible for the secretion of bowel, which can help in aiding in cholesterol and lipid digestion. We get the storage of nutrients. Our pancreas is where we're really going to focus with this lecture, because it's where we get our secretion of insulin, which is kind of our big factor with dealing with blood glucose when it gets into our bloodstream. And then our small intestine, where you get a lot of our absorption, rather it be through nutrients and water. And then the large intestine also does a lot of ions and water reabsorption, and then goes out through the colon as feces. So just to kind of walk through what our body does with sugar. So you eat something, say, an apple, it travels and goes down to your stomach, where your stomach breaks it down to its simplest forms, which would be glucose. That glucose then travels into your small intestine, where you get a large portion of your absorption. And then that glucose, like I said, absorbs into the blood vessels and travels into the blood system, blood vessels. And once it's in that blood vessels, your body recognizes the elevated blood glucose, and then your pancreas kind of comes in and secretes insulin, which then can allow for your glucose that's in the bloodstream to be taken up by cells that are along your blood vessels. So when insulin's secreted, you get the glucose comes in, and which then balances your blood glucose. Normal individual without any diabetes, you'll have a range of about 70 to 100 is kind of where someone would be that doesn't have diabetes. So when someone who does have diabetes and starts to develop that, we start to see the insulin is decreased, so you get more blood glucose kind of just circling around and not getting into cells. So you start to get a higher value into the 140s. For someone that ends up getting diagnosed with diabetes, you have 2 readings of greater than 140 to be diagnosed. So that tends to be kind of where someone's at. For someone with diabetes, we want to make sure that their blood glucose is staying at least below 130 just because of issues that can come with having uncontrolled and high blood glucose. So these are just the two different types. You do have a type 1, you have type 2. Type 1 tends to affect kind of your younger populations. It's when you're insulin dependent, so your body doesn't even produce its own insulin. Your body kind of attacks itself, so it's attacking those cells in the pancreas that can help release insulin. And there's a lot of different things that can cause type 1. It tends to be more of a genetic factor and maybe some environmental factors that kind of come into play. For someone with type 2 diabetes, it's insulin resistant. So you have your insulin, it's just not that effective. So your body can't really use it to help manage your glucose that's flowing around your blood vessels. It tends to be caused by a poor lifestyle choices. So not maybe the greatest diet, maybe it's fast food based, not getting good nutrition, and just a lack of exercise. So it usually affects an older generation, but it tends to now be coming down in age. So people in their 20s and their 30s tends to be more affected than when it was some decades ago, and tend to be in like your 40s when you start to kind of develop diabetes. So this kind of talks about your complications that can happen with diabetes. Over time, if you're uncontrolled and those blood glucose levels are staying above 130, you get a lot of complications. You get nerve damage, you get your kidneys become affected and don't work as well. Your eyes become affected and it can lead to blindness. You get skin conditions that can develop. So maybe like if you get a wound on your arm, it won't heal as fast and may become infected. And there's other issues that can happen if someone doesn't control their blood glucose levels. So some common signs and symptoms of diabetes. If you're not sure, or if you get a patient that comes into the pharmacy and maybe kind of explains some of these symptoms here, maybe you could lead them down the path of getting checked out by their doctor for potentially having diabetes. So you kind of see increases in urination, thirst, you get increased fatigue, you get increased infections, or like maybe you notice a cut isn't just not healing as quick as what it normally would. You usually get increased hunger. You get blurry vision. Again, that kind of goes back to your eyes being affected by diabetes, and then your tingling and numbness in your hands and feet. Again, nerve damage happens, and that's why that kind of condition can happen for patients. Signs and symptoms that kind of associate with type 1, you get weight loss because your body's not able to use the sugar that it's getting. So it's breaking down anything it can for energy, such as your muscles. So you kind of see someone that's losing weight and kind of looks more malnutritious, even if they're getting normal nutrition. A lot of nausea and vomiting and stomach pain is also associated with type 1 diabetes. So just to kind of talk a little bit about some non-drug treatment options for someone with diabetes or is pre-diabetic. Diet and exercise is a huge component. So managing how much sugar you're taking in, how many carbohydrates you're taking in, trying to optimize protein is a big factor when it comes to managing diabetes and managing if you're pre-diabetic. You want to get your required amount of exercise in per week. It is recommended to get around 150 minutes of physical activity. Foot care, like I said, it's possible that someone with diabetes starts to lose feeling in their feet. So something as simple as stepping on a tack, maybe you won't even feel it if you're a diabetic. And if you're not checking your feet often, then something as simple as that could turn into a raging infection that could ultimately lead to someone losing a toe or losing their foot because of how bad the infection could get. So doing daily checks on your feet, if possible, either by yourself or having a caregiver check the bottom of your feet just to make sure that everything looks healthy. And infection management. Again, if someone's not managing their blood glucose very well, they can tend to get more infections because like children, bacteria love sugar. So if you have a lot of sugar swing around in your blood vessels, your bacteria gets in there, starts to replicate and become a huge problem. So managing blood glucose to kind of minimize those infections becomes a huge thing for people with diabetes. So kind of on the drug side of treatments, these kind of drugs can be really optimized in someone with type 2 diabetes. Metformin is a big drug that we use for patients with type 2 diabetes. It's usually the #1 drug that we go to, but there are other options as well, such as GLP-1 agonists. Examples of those drugs would be like Trulicity, that you kind of see advertised on TV, or something like an SGLT2 inhibitor. An example of that would be like Jardiance, that you kind of see as advertised on TV. If someone's not managed on just a single therapy, because that's usually what we start with on patients, it's usually a monotherapy or single therapy. We can do add-ons to see like if we can manage their diabetes with other oral agents. So on top of, say, metformin, if that's what we want to start with, if they're not controlled, we can add some of those other first-line agents. Or we can add something like a DPP-4 inhibitor or a TCD as an option in therapy. Just to kind of go through now with some other therapy options. So someone who's a type 1 diabetic, they don't have insulin, so we have to give them some form of insulin so that they're able to break down this sugar that's in their bloodstream. So there's long-acting and there's short-acting. Your long-acting agents are something that we would have a patient inject themselves once a day or twice a day. Something like Lantus, Levemir, or Tresiba are some of those options, and you can see some of the photos. Those are your insulin pens. Your short-acting is someone's going to inject themselves before a meal. So if you're about to have a meal, you can check your sugar, see what it looks like, and you can give yourself a dose of some short-acting insulin to kind of help balance your blood glucose. That's stuff like Humalog, Novolog, are some of those short-acting agents that can be used. So just to kind of talk about what's the pharmacist's role in all of this? What do we do as a healthcare provider for patients with diabetes? So we kind of can counsel patients on how to give themselves an injection. What's proper technique of, sterilizing the injection site, how to measure up a dose. So using an insulin needle and showing someone, okay, this is how much you're going to draw up to get this much insulin. We can also counsel patients on side effects of medications, of what to expect when starting these new medications, especially with like metformin. A big side effect of metformin is diarrhea, and letting someone know that, hey, this could become an issue for you, and to let us know as soon as possible, because it could be coming from the drug. And what to do in an emergency situation. So if someone notices that their blood glucose is getting extremely elevated, we want to make sure that they know to get to an emergency room to kind of get reversal agents to help lower their blood glucose. Or if someone has maybe given themselves too much insulin, their blood glucose could become too low, and you just kind of get some dizziness and confusion that happens there, and what to do to reverse that. So giving someone some sugar can help reverse that, and making sure that a patient's aware what the proper amounts are of insulin to give in case something like that is common for them, and making sure something like that doesn't happen. So that kind of covers a lot of the stuff that happens with diabetes. Again, like I said in the beginning of this, me and Haley will be doing a live Q&A session later on to kind of answer any questions that you have. So if you listen to this multiple times and, you know, jot down some questions, me and her both will be in that live session to kind of answer anything that you have. So thank you for watching this video. And I look forward to speaking to a lot of you during the live Q&A to answer any questions that you have. So again, thank you for listening.